Hi, my name is Mohammad Yasser Baloch, an internal medicine resident with Florida State University College of Medicine at Tallahassee Memorial Healthcare. Today, I'll be talking about a rare case of resistant sternal osteomyelitis due to a superbug infection called Acinetobacter baumannii. Acinetobacter baumannii is an opportunistic bacterium that is becoming increasingly important over recent years as a cause of nosocomial infections. It can be frequently associated with ventilator-associated pneumonias, central line-associated bloodstream infections, or bony and soft tissue involvement. In case of latter, it is more commonly found in setting of open fracture wounds or traumatic injuries. We will talk about this bacterium presenting with sternal involvement, and based on our research, we were unable to find any documented report of Acinetobacter baumannii causing sternal osteomyelitis. Our patient is a 74-year-old male with multiple comorbid conditions, including multiple myeloma currently under remission, heart failure with reduced EF, and coronary artery disease. He recently underwent a coronary artery bypass graft surgery with a prolonged hospital course complicated by several in-hospital infections, including urinary tract infection, Klebsiella bacteremia, which were successfully treated with meropenem, and he was able to get discharged to the rehab. However, he returned back to the hospital from rehab complaining of worsening painful cough. He was found to have bilateral pleural effusions requiring thoracentesis. He was also found to have a poorly healing sternal wound, and there was concern for sternal osteomyelitis. Initial blood cultures were positive for methicillin-resistant Staph aureus, also called MRSA, which prompted use of vancomycin and meropenem. He was later switched to daptomycin due to declining renal function. Surgical team initially performed sternal wire removal followed by complete sternotomy, which was left to heal by secondary intention. Sternal cultures were found to be positive for MRSA. However, patient's wound continued to worsen despite antibiotic therapy, and hence required a repeat debridement with partial excision of multiple ribs, reconstruction of myocutaneous flaps, and multiple placement of drainage devices. Sternal cultures on repeat debridement revealed growth of multi-drug resistant Acinetobacter baumannii with resistance to carbapenems. Infectious disease who was already following the case suggested empiric treatment with cefiderocol and doxycycline, whereas daptomycin was also continued. Patient's overall condition improved. He was extubated, stepped down from the ICU, and was able to get discharged to an inpatient rehab hospital. For the sake of this presentation, as we followed his course at the rehab hospital, it was learned that goals of care were readdressed and patient was made comfort care before he was able to complete the planned 6-week regimen of cefiderocol. Figure 1 reveals wound cultures obtained from sternum after repeat debridement procedure, which clearly shows growth of Acinetobacter baumannii and is found to be pan-resistant to the antibiotic panel available in the hospital. Sensitivity to cefiderocol was checked and it was found to be sensitive. The widespread use of antibiotics has contributed to the ongoing rise of resistance to antimicrobial agents. Acinetobacter baumannii, among several other gram-negative bacilli, has seen a recent surge in resistance rates. Acinetobacter baumannii is a gram-negative cocobacillus that is characterized as aerobic, pleomorphic, non-motile, with a high incidence in immunocompromised patients. It has several important pathogenic mechanisms that play a role in its virulence and toxicity, including endotoxin production, biofilm formation, siderophore-mediated iron acquisition system. The primary mechanism of carbapenem resistance among gram-negative bacilli is hydrolysis via carbapenemase enzymes, which are often encoded in highly transmissible plasmids. Oxacillin carbapenemases, also called OXA, are a class of serine proteases with a high propensity to catalyze the breakdown of carbapenem antibiotics. OXA is frequently found in isolates of Acinetobacter baumannii, resulting in highly resistant strains of the organism. There is limited data on cefiderocol for treatment of osteomyelitis. However, there are case reports on successful use of cefiderocol-containing treatment regimens in patients with extremely drug-resistant gram-negative infections like our patient. With limited possibilities when it comes to treating such infections, novel agents like cefiderocol offer promising results based on clinical experience. It would be challenging to get randomized trials addressing efficacy, largely because such drugs are reserved for use in setting of highly resistant organisms. Figure 2 demonstrates cefiderocol's chemical structure, which is a cephalosporin molecule attached to a catechol side chain, which happens to be an iron-binding siderophore and is able to chelate iron and hence enter bacterial cells. Here are some of the resources we used to prepare the case. We appreciate your time reading the case. Thank you so much.